It's Friday, February 5th, and it's time for your Barbados Today morning news update. Government will act hastily to revoke exemptions granted to businesses to open if they ran afoul of the law. So warned Attorney General Dale Marshall, who pointed out that any business given permission to operate during the national pause must do so within the stipulated boundaries. Only those businesses deemed to be essential and those receiving special authorization are allowed to open during the February 3rd to 17th lockdown.
I can say to you that even though the list was published last Sunday, the occasion has arisen based on further consultation and strong representation that there are a number of rural areas that are not easily satisfied by shopping facilities nearby, and we've therefore added an additional 4 mini marts to complement those that already existed. Those have been brought in by way of exemption, but this weekend we will now publish an updated list. Let me make it clear. Where exemptions have been granted, if any of those entities run afoul of the established protocols, we will not hesitate to revoke the exemption. Plain and simple. And that doesn't just apply to mini marts, that applies to companies that we allow to do business of any kind. If you breach the protocols, rest assured that we are going to revoke any exemption that you might have.
Marshall said while bakeries had been allowed to remain open, there had been reports of bread vans parking alongside the road, attracting large crowds, and this was a development that might have to be addressed. Now today marks the 3rd day of the national lockdown, and the AG said he had not received any reports of incidents from the police so far.
Our overriding objective in this lockdown, as with last time, is that we reduce the amount of human-to-human interaction, the amount of human-to-human contact, so as to reduce significantly the risk of the spread of COVID. When we were last in lockdown, the COVID numbers were 1 today, 2 tomorrow, numbers that even then we found extremely disconcerting. But Barbadians then handled the measures well. And from all that I can see, all that I've been able to observe in the lead up to this period, and certainly as we have commenced this period, I think that Barbadians are handling it well. I don't think that a curfew arrangement, that a lockdown is something that we should ever want to become comfortable with. It is an uneasy feeling not being able to leave your home. But obviously, as I said, the overriding objective is to reduce human-to-human contact. So far, I've not received reports of any challenges from the Royal Barbados Police Force, and I therefore have every reason to believe that Barbadians are behaving in an orderly fashion.
The Royal Barbados Police Force strongly defends its policy with regards to the treatment of officers in the current COVID-19 climate. Deputy Commissioner of Police responsible for investigations, Owen Boyce, said the RBPF has a clear policy and its own internal procedures related to how officers should function amidst the pandemic, as well as protocols which are guided by the Ministry of Health. Emmanuel Joseph picks up that story.
Deputy Commissioner Boyce was responding to a story published by Barbados Today in its Wednesday edition, where President of the Barbados Police Association, Mervyn Grace, called for a clear policy on how the administration was dealing with members during the spread of the virus.
Our response is there's a very clear policy, and that policy has been in effect for a little while. We work with medical, and we work with the medical people and with our own protocols to ensure that officer safety, officer health and well-being is being safeguarded.
The Police Association president had also said that too many complaints are being made to its executive of officers being told to turn up for duty even though they are still awaiting COVID-19 test results. But Deputy Commissioner Boyce is insisting that instructing police officers to report for duty while they are awaiting test results is not something the administration would do.
There are protocols in place. We consult with the medical people in terms of, how should I put that? In terms of ensuring that their well-being and their health are protected at all times. And we will not be asking a person to return to work unless the medical had said to us that the person can return to work.
Deputy Commissioner of Police responsible for investigations, Erwin Boyce. And I'm Emmanuel Joseph for Barbados Today.
Government's Operation Seek and Save COVID-19 and Dengue Fever Community at Risk Household Survey has gotten off to a very good start. That's according to Dr. Dion Greenidge, head of the Department of Management Studies at the Cayville campus of the University of the West Indies, where the data gathering system was designed and developed. More from Emmanuel Joseph.
Reporting on the first full day of the Seek and Save Household Survey on Thursday, Dr. Greenidge said the 360 students who are conducting the study under the supervision of officers from the Barbados Defense Force are requesting information on the risk factors related to COVID virus and the dengue fever. He disclosed that so far some 3,236 households in all 30 constituencies across Barbados had been covered. The Management Studies Department head said the kind of data being sought include whether householders kept containers in the area that could take in water, which would breed the Aedes aegypti mosquito that causes the dengue fever.
We are looking at both COVID and dengue risk factors, and that is why I said earlier that we're not really interested in person's personal individual names, but we're interested in information that will help us to identify the risk factors, those persons at risk, those areas at risk, and to be able to make what I would say effective interventions and decisions.
Dr. Greenidge assured Barbadians that the data which the students are gathering is being treated in the strictest confidence, and once it is put into the specially protected phones given to volunteers in the field, it goes immediately to a secure server at the University of the West Indies in real time and can only be accessed by those certified for that purpose. Meanwhile, he is over the moon regarding the manner in which the students carried out their tasks and the feedback from householders Thursday. Emmanuel Joseph for Barbados Today.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region, St. Lucia records another COVID-19 related death, this time from the prison. Director of Corrections at the Bodily Corrections Facility on Thursday confirmed that one of the 8 inmates at the penal institution who had been diagnosed with the viral illness had died. More in this report from HTS News Force.
Director of Corrections Hilary Herman said he received word of the passing of the prisoner on Wednesday.
Yes, I can confirm that we had one COVID complication death at the respiratory hospital, Victoria Hospital. We were notified yesterday. He was one of the 8 inmates that was originally tested positive, and he showed symptoms, so he was conveyed to the Victoria Hospital about 4 days ago, and we were notified yesterday that he passed away. That inmate worked in the kitchen, and that's where we had the initial contact of COVID-19. He was part of the inmates that worked in the kitchen, so I don't know if you can make that correlation, but he was a worker in the kitchen. He was found positive. He had the symptoms. He was taken to the respiratory hospital, and he passed away 4 days later.
The Bodily Correctional Facility has been under the spotlight of late. On Tuesday, prisoners from the remand section took to social media to register their complaints, which include overcrowding, lack of sanitary supplies to safeguard against COVID-19, and the long delay in their cases being heard by the courts.
I think as you watch all the videos you saw out there, COVID-19 was the least of every inmate's problem. You will see that every inmate was highlighting the time on remand because this was what it was.
On the international scene, United States congressional investigators found dangerous levels of toxic heavy metals in certain baby foods, a House of Representatives Oversight Subcommittee said in a report released on Thursday. More from CBS News.
The report says many baby foods have dangerous levels of toxic heavy metals, including arsenic, lead, cadmium, and mercury.
Chloe, you want more?
Something Connecticut mom Carrie Kerner never thought her 1-year-old daughter Chloe might be eating.
That's the least thing a mother wants to think about. That's very concerning as a new mom.
Investigators said internal documents from 4 U.S. baby food manufacturers showed toxic metals in baby foods at levels higher than other products. When compared to government limits for bottled water, the results were up to 91 times the arsenic level, up to 177 times the lead level, and up to 69 times the cadmium level. UCSF professor Tracy Woodruff.
A baby who's eating this food can be exposed to multiples of these contaminants.
The majority of companies told us they're committed to safety, follow government rules and their own internal standards, and are working on voluntary proposals to limit metals. Congressman Raja Krishnamurthy says voluntary efforts aren't enough.
We need the FDA to step into the breach and do what I think the American people believe it is its job to do, which is to make sure that the food that their babies consume is safe.
The FDA says it's working on it, but acknowledges there's more work to be done.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.